I call upon Ramalinga Reddy, sir, for his talk on practice pearls. Sir is from Narsarapeta.
Okay. These are nothing but a few sessions by my friend Dr. Sunil. There are neither pearls nor diamonds in the practice. Just I want to tell you why I started my practice, because I started my practice in 1986 when I was not offered a government job and nobody took me for service in any hospital. So as a last resort, I started my practice, and I just want to make it very clear to all the people that a good practice doesn't need a brilliant top brass ophthalmologist. It's only for average fellows like me, not you, sir, who want to earn more money, name and fame in the society. So next, I started my practice with the small equipments which costed me 5,000 rupees at that time. So next thing is, for every practitioner you have to go through 3 stages like this one. When I started my practice, it was like this. Usually it is like this. After some time you end up like this. So only for few people it will be like this. So why is this scenario so different? Is it because of some superhuman efforts? No. The fellow who is seeing this OP is spending a lot less time with the patient. He is less accurate in diagnosis also, and patients require a lot of recommendations to be seen early. They don't have proper chairs and not even drinking facility and washrooms also. But people definitely go there only. Why? That is a thing which is not written in any books, and there is no fixed this thing. These are my opinions. They need not be true. After analyzing my practice, I came to conclude a few points that they may not be true for everyone. So I want to highlight some of the qualities which a private practitioner has to adopt. Availability is one thing which is very essential. You have to go and sit in the OP right from the morning to evening if you don't have any single patient. Whenever the patient comes, you have to see. You should not wait till the patients accumulate and then you go. It is not correct. You have to be there at each point. And second thing is sincerity towards the profession and the empathy towards the patient. You must be very sincere. మనోవాచ కర్మణ అంటారే ఆ విధంగా. సో యూ హ్యావ్ టు డెడికేట్ యువర్ సెల్ఫ్ టు ది వెల్ఫేర్ ఆఫ్ ది పేషెంట్. దెన్ ఓన్లీ యూ విల్ succeed in your this thing. So next important thing is the appearance of the doctor when the patient visits him. It should not be like this. Even we don't like this type of doctor if we go for any treatment. We like this fellow who is receptive to the patient, talks very empathetically and with a lot of concern. So this appearance is more important. Next thing is attentive listening. Hearing is different from listening. When the patient comes, you spend a few minutes of uninterrupted, let him talk uninterruptedly for 2 minutes. Then my experience is he will tell you the disease, what the disease is. If you let him talk, he will tell you what he is suffering from, why he changed the previous doctor. Because our patient was sometimes, at one point of time, he was another doctor's patient. So he came to us just because you have to listen it. So he will tell you the diagnosis, he will tell you why he is not going to the previous person, and he will tell you the treatment also, what he wants from you. So then best thing is call everybody by name. Name is very important for everybody. So calling by name requires a lot of skill and attention and practice also. Whenever you call anybody by name, it indicates a rapport, recognition, and importance to the person, so that he is ready to listen to what you say. So try to develop that habit of calling everybody by name. Then comes the thing like who is your boss? Bosses differ at various places. In our houses, like for senior citizens, our wife is our boss, not for Sunil. Because after 20 years of marriage, definitely your boss will be your wife. So what is the main character of a boss? Boss is never satisfied with your work. He will be critical. He will go on observing you, and at even a slightest opportunity will try to criticize you. Same is the thing with the patient also. Patient is your boss in the hospital. You treat him like a boss. The saying goes, boss is always right. So if the patient says your treatment is good, it is good. If the patient says you are a bad doctor, you are definitely a bad doctor. Your staff are bad, definitely it is bad. So you have to satisfy this fellow to sustain practice. So once you deal with the patient, then comes the important person. Most important person is the attendant. So on the left side is the attendant and right side is the patient. So see how small the patient is when compared to the attendant. So attendant is the person who brings the patient to the hospital, who bears all the expenditure, and moreover he is not blind, so he doesn't he observes everything in the hospital, and he will analyze you very critically. So beware of the attendant and try to pay more attention to him. Like what we do usually is this thing. You sit and the patient also sits, attendant stands like that. I thought I followed it for some time, but then I switched over to this method and started talking to the patient, to the attendant. Then the results were dramatic, because attendant will convince the patient for everything. If you just follow the trick that patient seems to be less intelligent, you are more intelligent, you try to convince the patient, he will definitely convince the patient, and it will bring a lot of, you will see the results if you respect the attendant. So everything is over. Now how to retain, once you got the best practice, how to retain the practice. Because getting practice is one thing, and retaining it is even more important than getting practice. You have to maintain good staff, like Dr. Sudhakar Rao told, pleasing, obedient, duty-minded, dedicated, and long-standing staff. After all, staff are an extension of the doctor, and patient spends more time with the staff rather than the doctor. So try to employ good staff. And nowadays, even this type of staff are also required for obvious reasons. You will practice. These are all my staff only. Some of my staff. There are many more. They could not be accommodated in the frame. So you can practice with a lot of confidence and respect also. Command respect from the public. So, but these people need more payments. Then updating your knowledge is even more important, because science is always very advancing. Moreover, ophthalmology is more and more advancing. So you have to update your skills. How you update the skills? Sitting always in the OP and updating the knowledge are quite controversial. You cannot do both. So there is one small way of doing that. One way is purchasing the equipment is one thing. Another thing is refer the most difficult cases to the best institutes available and try to follow up with the consultant. What he did, what was the disease, what was the fault with you. That way you can update your knowledge. Luckily we have a big institute in Guntur, Shankara Netralaya, and previously it was L.V. Prasad Institute, who used to write letters for the doctor who referred the patient. So what was the diagnosis, what was the management, where you went wrong, everything you will get. So that is the one way of updating your knowledge, sitting in the hospital 24 hours a day. And another thing is, this may not be true, because all people in urban area may not get the villagers. But one difference between a villager and a town patient is, villager is a patient for the lifetime. Once he comes, he keeps on coming till either he dies or you die. But urban patients, it is not correct. He goes on window shopping. So try to have more village patients. And counseling is also one part. Counseling plays major role in retaining your practice. First thing is, just I want to tell you one small thing and a small trick also. Patient is having cataract and it is to be operated. So what I heard, and I learned from the mistakes of others. One doctor in Vijayawada told the patient that you have to get operated now itself, within 1 hour. The patient told him that, sir, my attendant is not, he is at Narsarapet and he is coming to Vijayawada in 2 hours. No, I will look after you. You lie down on the operation table. That type of hurry will not work. That creates a lot of suspicion in the minds of the patient. Because after all, cataract is never an emergency unless it is glaucomatous. It induces glaucoma. And you cannot promote multifocals or trifocals for a village poor patients. You have to see the condition of the patient while promoting the lenses. And even for guarded prognosis cases, you have to see and try to eliminate the cases in the beginning, because however good you are, if you deal with a case and the result is not good, even if you know and if you convince the patient asked you to do it, even if it is not good, but at the end of the thing he will tell you that I spent 20,000 rupees with Dr. Reddy, but I couldn't get the vision. He told him everything beforehand, but at the end of the day he will tell you the same thing. So never, as a private practitioner, never try to take up guarded prognosis cases. And always patients go on testing you now and then. They don't bring the old OP cards to you, and they want to ask you what is the diagnosis. Even they don't tell the complaint also. You have to match the diagnosis of your previous 1 year or 1 month back. What you told, you have to remember, tell him. So best thing is make a protocol and tell this is the thing. So you go on telling the same thing each and every time. You make it a habit so that these faults will not happen again and again. Never criticize anybody in your locality or even outside. Good public relations are also important. And make friends with people outside your doctor community, because doctors will not come to your rescue at an emergency. Only people from outside doctor community, they come to your rescue very openly and instantly also. They have a lot of time and they respect you. So have friends even outside the doctor community. And crisis management is very important. Everybody is likely to have unexpected crisis during the practice. Patient may have bad post-operative result. Even life may be at risk. All these conditions, you must be able to manage the crisis. Crisis management, you cannot run away from the practice. So crisis management is very important. And key persons, medical, okay, then developing the practice is one thing. There are few key persons who are helpful to improve your practice. One is medical and paramedical persons. So you treat them free. All your compounders, nurses, compounder nurses of others in the same town or other towns also, ANMs, village workers, village heads and politicians, school teachers and wardens, and pastors. These people play a very important role. You encounter problems, they come to your rescue. Why? All these people are surrounded by people who will listen to them. School teachers, politicians, village heads, pastors, and all these things. So there is a special class of people I'm going to show you next. You have to take out identify them in the practice. So you see these 5 people. Is anyone different from the other? No. He is the person. The first one brings a auto full of patients every time he comes from the village. 10 people, he brings 10 people, takes away his rewards, and he brings all the 10 people and promotes them about the best lenses also. He does a lot of counseling and all that. These people, you have to identify them and then make them your friends.
Thank you.
And okay, yes, time is over.
No, sir, next class.
Dealing with failures is also important. Once there is a failure, you have to deal with them. You have to tell the patient openly that what happened and what is the best way to get rid of it. You try to take initiative and send them to bigger institutes where the patient will get better. Don't take money into consideration. And this is one thing which I experienced. There is a lot of usefulness. You give discounts, you get more patients. Don't say that even this money, I don't get any profit out of your treatment. Always offer discounts whenever, very freely.
Sir, we're running short of time, sir.
Okay.
One more speaker is there.
Okay, then it's over.
Sorry.
All right, no problem, no problem. So you get feedback from the patient, and this is my family. I'm thankful to all of them for their support throughout the careers.
Thank you, sir.
Right.
Very nice tips you have. Only lack of time.